Kids often say they can't wait until they turn 18 so they can finally be on their own and make their own decisions separate from their parents. I know I was excited to reach the age of majority as well, but sometimes I wish I could go back to the time of my life when I didn't have nearly as many responsibilities and things to learn in order to become a successful adult. Being that this is a college course, there are at least a few of my classmates that may be minors and others who may have children that these laws may pertain to, but it's just generally important to be knowledgeable about the laws of the land. My name is Sarah LaCroix, and even though I'm only 24 years old, for the last decade, I have exclusively been making my own decisions relating to my medical care. Minors are now having a greater say regarding what medical care they should receive. Today, we will discuss the historic rights given to minors, how their rights are changing, what our state laws regarding these rights include, and how these laws will continue to evolve in the future. Now that we have established the main points of this issue, I'll now expand on each of them. The first solid example of humans recognizing the rights of children and the importance of protecting them dates back to September 26, 1924, when the League of Nations officially adopted the Geneva Declaration of the Rights of the Child. It included a set of simple guidelines that every child should be entitled to, like the right to adequate nutrition, housing, and medical services. In most states, people are considered to be minors until the age of 18 when they reach majority, but in some states it varies up to the age of 21. Though Florida's age of majority is 18, just next door in Alabama, it's 19. The evolution of our cultures and norms over the years, as well as the constantly developing abilities of the medical field, have all fueled the fire that has made this a misunderstood issue for many. Whichever population you may be a part of, you have certain rights that you may not even be aware of. And if the general public isn't made aware of all of the laws and statutes, controversy may arise. Some of the issues regarding healthcare, especially when it involves a young person, become very sensitive topics that various political and religious groups, as well as individuals, may have strong feelings and opinions about. In the state of Alabama, the laws regarding the rights of minors are quite severe in comparison to some, but are much more clear than some others. Alabama Code 2284 defines when minors may give consent generally as any minor who is 14 years of age or older, or has graduated from high school, or is married, or having been married, is divorced, or is pregnant, may give effective consent to any legally authorized medical, dental, health, or mental health services for himself or herself, and the consent of no other person shall be necessary. Laws and statutes for Florida minors are slightly more involved. Basically, unless you go through the process of emancipating yourself, are married or pregnant, or you have to have your parents' consent for most medical care. There are a few exceptions to these rules according to the 2013 Florida Statutes by the Florida Legislature. Medical care can be performed on a minor without parental consent in the event of emergency when life-sustaining care is needed. Notification of a parent or guardian must be achieved as soon as possible in that situation. Minors 13 and up can consent to outpatient crisis intervention treatment without parental consent. This is mostly limited to therapy and counseling services. If drug therapy, or if the medical provider feels that it is needed for the well-being of the child, parental consent can then be sought. It is interesting to know that this treatment is provided at no cost to the patient or the parent unless parent participation occurs. This statute is a part of the Baker Act, also known as the Florida Mental Health Act. Minors can also consent to voluntary substance abuse treatment and the diagnosis and treatment of STDs. At the age of 17, minors in Florida can donate blood without compensation unless the parent or parents of such minor specifically objects in writing to the donation or to the penetration of the skin, according to the 2013 Florida Statute, Chapter 743.06. Probably the most controversial topic, minor's termination of pregnancy is allowed as long as the parent signs a form that they have been notified prior to the procedure. This does not mean that the parent gives consent, it just means that they know that it's going to happen. The other option is to attain judicial bypass by petitioning for it and the judge deciding that the minor is mature enough to make the decision on their own, or if the judge decides that telling their parent wouldn't be in their best interest. Judicial bypass is also available at no cost, as stated in Florida Parental Notification for Abortion Requirement by the North Florida Women's Health and Counseling Services Incorporated. The protection of minors to make these decisions and the fact that the information will remain unknown to their parents can sometimes be the deciding factor in whether or not the minor seeks help at all. Doctors are by law supposed to advise the minor patient to include their parents in their treatment, but sometimes the doctor can make judgments whether they are mature enough or whether notification of the parents is needed. This shows just how involved a doctor's job really is, since they have to first recognize and diagnose a patient's situation, but then also, at times, act as a counselor and investigator to be able to make decisions about the minor's capacity to understand and make good decisions regarding their health and well-being. Now that we have discussed the specifics, we will now see how they continue to affect us as time goes by. As stated, February 19, 2009, in the Houston Journal of Health, Law, and Policy by Jennifer Rosado, the resolution of these conflicts in the context of medical decision-making is rendered even more difficult by constantly evolving medical innovations that the law is ill-prepared to address. The issue of giving a minor more responsibilities can be compared to the increased responsibility a minor is expected to have as they get older and have more chores to do around the home. Doing the right thing and making sure they understand why it's right is an important part of the learning process of children. If they always have their decisions made for them, at the age of majority, they may enter the real world without the proper skills to make their own informed choices. In an article in the August 2008 issue of the American Medical Association Journal of Ethics called Learning to Decide, Involving Children in Their Healthcare, Sarah Taub, MA, says, mirroring the progression of their development, children's involvement in healthcare decisions should occur along a spectrum, the first stage of which is being informed. You can get informed about your rights by visiting your state's official law statutes website. Florida's site is ledge.state.fl.us, and as I've realized in the last few weeks, there's no end to the information you can find. We've now mentioned the specifics of this issue and the future implications, so we will now mirror our own progression. Minors are now having a greater say regarding what medical care they should receive. We have now discussed the historic rights given to minors and how their rights are changing, what our state laws regarding these rights include, and how they will continue to evolve in the future. Regardless of what state you reside in, or if you're a minor, it's imperative that you're aware of the rights you have, especially when it involves your health. It could save your life.